Hi, I'm Julie Hill with Movement Therapy. I help people eliminate pain and get back into doing the activities they love as a function movement specialist and a breathing coach. Today, I wanted to talk to you about outer hip pain or inner groin pain and how that can be caused by what I refer to as lazy hip, which would mean that when you're standing on one leg, let's say that it was my left side, I might come into my tree pose by letting that hip kind of slide over and then bringing that foot up. Or I might be walking in my gait and letting that hip come over as I swing the opposite leg through. Over time, that causes a lot of compensation between your abductors and your adductors. And there's a functional movement that can bring balance back into those two muscles. And so I wanted to show you that. There's lots of things that can cause outer hip pain, but this is a common one that I work with clients. And so we can come into a half kneeling position, coming down. And there's a couple things that you'll see if this is an issue with you is that you'll find this hip will come over, meaning that the leg is slanted over to the side rather than having the leg straight up and down. So you'd want to do this in front of a mirror. You bring the knee down with the side that you're working on. Another common compensation that you'll find is that the other leg will kind of set out a little bit, compensating for what the hip has trouble doing. So you want to make sure that the other knee is directly in front of its hip, and then work to bring this hip in. You might have a table or a chair seat next to you so you can really push down as you work to bring this in. You're also going to make sure that that back foot is flipped under. So the toes are flipped under, the toe pads are touching, and you're working to connect that pinky toe behind you. And I know some of you think your pinky toes are really short, but it is meant to touch. It just hasn't done it in a long time. And so we'll just keep working this hip in. That's the main thing that we're working on. Building stability through this hip joint evenly between outside and inside. When you've got that and you're feeling comfortable, and maybe you can take your hand off that chair seat and still maintain this leg straight up and down and kind of pulled in, you can start getting light in the opposite toes. Bringing those toes off the floor a little bit and just kind of working to balance, to breathe, relax your shoulders and so forth. Or you might try lifting that heel. Eventually, when you get really functional at this, and this hip can maintain that stability through the leg bone itself, you can start to lift this other leg completely off the floor and get a little bit of hang time. Notice I'm not leaning way back to make that happen. I've waited until this started to gain some strength and mobility here and then starting to lift it up. So half kneeling, a lunge is a great way, a functional way to bring balance back into that hip. Here's to a happier and healthier you. If you have any questions, don't hesitate to reach out. You can find more information at juliehillmt.com.